We had a question recently from someone who was just totally flummoxed, confused, because they went to a doctor's office, and then when they got their bill, they got the bill for treating them, and their health plan took care of most of that. They had a small copay. And then they had a junk fee for something called a facility fee. And this is an ugly thing happening all over America, especially in any mid-size or large metro area. It is a plague. And you need to understand how you're being cheated by major medical centers, major hospitals in metro areas. Here's what happens. So you go to the doctor's office in a medical building or in a shopping center or whatever it is, or it could be a freestander, but usually it'll be a strip center or something like that. Go to the doctor's office, routine doctor's office, not an urgent care, not an off-site emergency place, anything like that. And then you get hit with this giant bill. What's happened is the hospitals are gobbling up medical practices. So they've got feeders when somebody's sick, that the answer to every question is you go to something with that hospital system. So the hospitals are going to the doctors and they're buying their practices. And it looks exactly the same. It'll be Dr. blah, blah, blah on the door. But then you get the bill, and the way the hospitals playing this game where their heads they win, tails they win. They're paying the doctor usually millions to buy the practice, and then they make back that money two ways. One, by getting the doctor to funnel patients into the high-cost hospital services, and making up the millions they paid the doctor by charging you this junk fee that could be $100 or $200 so often. And insurance is going to tell you, we're not paying that. So when you're hiring a new doctor or when you're making an appointment with one you already have, just remember to ask the question, are you adding a facility fee to bills now? If the answer is yes, you need to go find a new doctor. The hospitals are playing a dirty game with your and my wallet. There is no excuse for this. And it's a practice that should be banned. The wild thing is most of these hospital systems that are playing this dirty pool are nonprofits, paying administrators $3 million, $5 million, $10 million a year, and paying no tax, not contributing any tax dollars to the community. And they're not really nonprofits. They are running profit engines tax-free. And then they're turning around and cheating the customers, the patients, with these junk fees. Know this is going on, and know that you are the one who's left before you receive service, to ask the question, do you charge a facilities fee? And if they do charge a facility fee, then that's when you need to consider, is it worth it to you to pay an extra $100 or $200 out of pocket to visit that doctor? Or is it worth it more for you to go find another doctor who's not owned by one of the hospital systems? Something else you need to know that really became an issue in the last, I'd say probably in 22 forward, is the health insurance industry is playing games with you when you go out of network. You know how your plan will have, if you have health coverage, there will be in-network, and it's pretty predictable. You have this copay other than this thing I just told you about with the rip-off facility fee. But you'll see if you go in-network, you've got the copay, and you've got this deductible and all that. But then if you go out of network, the formula is completely different. Well, the insurance companies are using outside software providers to beat down the amount that they'll cover under your plan when you go out of network, so that you end up having to pay a lot more out of pocket than what you think based on what the plan says. Know that the incentives are becoming so strong for you to stay in network and so brutal for you if you go out of network that the plan document saying this is the most you'll have to pay out of pocket and all that when you go out of network, it's really become somewhat a fiction. And you need to know that your medical care needs to be in network as much as absolutely possible.